So for the nutrition for infants, they need the calcium because it helps them to build strong bones and teeth, and then they also need fat because it creates energy and helps the brain to develop, and it also keeps the skin and hair healthy and protects against infection. And then they also need folate, which helps with the cells division. And then for iron, it builds blood cells and helps the brain to develop. And then breastfed babies should receive iron supplements. And then they also need protein and carbohydrate because it provide energy and fuel growth. And then lastly, they need zinc, which helps the cells grow and repair themselves. And as for the school age children, always give them breakfast, even though this has to be like on the run. So here's some ideas for a quick healthy breakfast. So they can be fruits, milk, bagel, cheese toast, cereal, peanut butter, and sandwich. And then for the nutrition for the patient with ADHD, it is better for them to have like high protein diets. So beans, cheese, eggs, meats, and nuts can be a good sources for protein. And then eat this kind of food in the morning and for after school snacks. And then they also need more complex carbohydrates because our body needs carbohydrate because it converts them into glucose to use for energy. And then load up on vegetables and some fruits, including oranges, pears, grapefruits, apple, and kiwis. And eat this type of food in the morning. In the evening will help them to sleep. And then the role of nutrition in gingival health. So for the vitamin C, it is critical for collagen formation. Vitamin C supports the structural integrity of gum tissues. A deficiency can lead to bleeding gums and increase the risk of periodontal disease, like gingivitis or periodontitis. And then as for vitamin A, it supports the maintenance and repair for mucosa tissues, including the gum. And inadequate vitamin A can help keep the overall soft tissues healthy and resist infection. And the third one is omega-3 fatty acids is known for their anti-inflammatory properties. So it can reduce the inflammation in the gum and help manage periodontal disease by decreasing the body's inflammatory response to plaque. And then they also need zinc. So it plays a role in the immune function and wound healing, which is crucial for maintaining healthy gums and fighting for infection. So lastly, for antioxidants such as vitamin E, so they can protect our tissues from oxidative stress and inflammation, which are contributing factors to gum tissues. And then lastly, for the nutrition for patients who are doing their pregnancy, the first one will be the folic acid, which is vitamin B9. And then it is essential for preventing neural tube defects in the baby. And then it supports the development of the fetal nervous system and proper DNA synthesis. And the second one is iron because it supports the increased blood volume in the mother and helps deliver oxygen to the baby. Iron deficiency can lead to anemia, fatigue, and an increased risk for premature birth or low birth weight. And the third one is calcium. It is crucial for the development of the baby's bones and teeth. If the mother's doesn't get enough calcium, the baby will draw calcium from her bone, which can increase the risk of osteoporosis later in life. And the fourth one is on vitamin D. It works in conjunction with calcium to promote healthy bone development in the fetus and helps support the mother's immune system. So the low level of vitamin D can lead to complications like diabetes and low birth weight. And the fifth one is omega-3 fatty acids, which is DHA. It is very vital for the baby's brain and eye development. And then they also reduce inflammation and may help prevent preterm labor and depression. And for the sixth one is protein. It is essential for the growth of fetal tissue, including the brain, and supports the maternal tissue growth, such as the uterus or breast. And then for magnesium, it helps regulate blood sugar levels, supports the development of bone and teeth, and it also may help prevent preterm labor and hypertension during pregnancy. And then lastly, no, the second to the last is pregnancy hormones slow down digestion, so which can lead to constipation. So fiber helps promote healthy digestion and prevent constipation. And the lastly is the water. So adequate hydration supports increased blood volume in pregnancy, which helps form menial fluid and can prevent urinary tract infection and constipation.